Hey there, I'm Margaret. After spending 35 years as an ER nurse, I thought I knew everything about our healthcare system. Then I got sick. Really sick. And suddenly, I was on the other side of the clipboard, staring at medical bills that totaled more than my mortgage. $47,000 to be exact. In retirement. With fixed income. I remember sitting at my kitchen table, hands shaking, wondering if I'd have to sell my home just to pay for the surgery that saved my life. But I didn't. Instead, I used insider knowledge from my nursing career to slash those bills by over 60%. That's right, I paid less than half of what they initially billed me. And today, I'm going to show you exactly how I did it, step by step. Let me tell you something most healthcare providers won't. Medical billing is essentially a negotiation game. During my nursing career, I watched countless patients pay full price for services that insurance companies would pay pennies on the dollar for. Why? Because they didn't know any better. Here's what happens behind the scenes. Hospitals and doctors set incredibly high chargemaster rates. Think of them as the sticker price on a car. Nobody, not insurance companies, not Medicare, actually pays these rates. They are artificially inflated starting points. When I received my first post-surgery bill, it was for $23,450 just for the hospital stay. The itemized charges included $187 for a single Tylenol pill and $962 for a surgical kit that I know for a fact cost the hospital about $40. This isn't uncommon or illegal, it's just how the system works. The first step to cutting your bills is understanding this fundamental truth. The first number they show you is not the real price. It's where the negotiation begins. And you absolutely can negotiate, even if you're just one person against a massive healthcare system. I remember calling the billing department and saying, "I understand these are your chargemaster rates, but I'd like to discuss what your Medicare reimbursement rate would be for these same services." There was a long pause. And then the conversation completely changed. They knew I understood the game. One of the biggest mistakes patients make is accepting summary bills without question. When I received my first bill, it simply said hospital services with a massive number next to it. That's like going to a restaurant and getting a receipt that just says food, $500 without listing what you ate. I immediately called and requested fully itemized bills for every service. Under federal law, they have to provide this to you. When I got the itemized statement, I found over $7,200 in errors, including procedures I never received and medications I never took. I found charges for daily physical therapy sessions when I'd only had 3 sessions total. I found duplicate charges for lab work. I even found charges for a private room when I'd stayed in a shared room. This isn't necessarily fraud. Medical billing is complicated, and mistakes happen all the time. But these mistakes almost always benefit the hospital, not you. Make sure you understand every single line item. Google anything you don't recognize. Cross-reference with your own records. If you were in the hospital for 3 days, count how many days they're charging you for. Check medication names and dosages. In my case, simply identifying and disputing these errors cut my bill by over $7,000. That's before I even started negotiating the legitimate charges. Even if you have insurance, understanding exactly what they cover and how they cover it is crucial. When my bills started coming in, I realized that while my procedure was covered, the anesthesiologist was out of network. This single oversight could have, Cost me thousands. The first thing I did was pull out my insurance policy and read it cover to cover. I know that sounds tedious, but it's worth it. I discovered that my policy had a provision for gap exceptions when in-network providers weren't available. Since there was no in-network anesthesiologist available during my emergency surgery, I qualified for in-network coverage rates. One phone call to my insurance company, where I specifically cited this provision by name and page number, saved me $4,300. The representative actually said to me, "Most people don't know about this provision." Of course they don't. The policies are designed to be confusing. Another insurance trick: always appeal denied claims. Insurance companies automatically deny about 20% of claims on the first submission. They're counting on you not having the energy to fight it. When my follow-up physical therapy was initially denied, I appealed with a letter from my surgeon explaining its necessity. The denial was reversed within 2 weeks. Remember, insurance companies are for-profit businesses. Their business model depends on collecting premiums and paying out as little as possible. Your job is to make sure they fulfill their contractual obligations to you. Here's something I learned during my nursing career that most patients never realize: when you negotiate matters almost as much as how you negotiate. Hospitals have monthly, quarterly, and annual collection goals. As they approach the end of these periods, they become much more willing to settle accounts for less than the full amount. I timed my negotiations for the last week of the hospital's fiscal quarter, which I learned by simply asking a friendly billing department employee when their quarter ended. I called on a Tuesday afternoon, avoiding Mondays when they're swamped and Fridays when they're rushing to leave, and spoke to a billing specialist. I explained that I wanted to settle my account in full today, if we could agree on a reasonable amount. The urgency of immediate payment combined with their end-of-quarter goals resulted in them accepting a 35% reduction on the spot. Another timing trick: many hospitals have a prompt pay discount that isn't advertised but is available if you ask. These discounts, usually 10–20%, are offered if you pay your portion within 30 days of billing. When I called about my outpatient follow-up care bill of $2,845, I simply asked, "Do you offer any discounts for prompt payment?" They immediately offered 15% off if I paid within 2 weeks. Timing also applies to when you seek care, when possible. My scheduled follow-up, MRI, was going to cost $2,300 at the hospital. By calling around to independent imaging centers and scheduling it for their last appointment of the day, I got the exact same MRI for $725. That's a 68% savings for the exact same procedure. One of the most powerful negotiating tools you have is offering to pay cash immediately. Healthcare providers spend enormous amounts of money on billing, collections, and chasing down payments. Many will gladly accept a significantly reduced payment if it's guaranteed and immediate. For my post-surgical specialist visits, I asked a simple question that saved me thousands. "What's your cash price if I pay today?" The $320 office visit immediately dropped to $175. The $840 ultrasound dropped to $380. This works especially well with independent physicians and smaller practices. They often pay 7–10% in credit card processing fees, plus additional costs for billing and collections. Offering cash payment eliminates these expenses for them while saving you money. I used this approach for my prescription medications too. Instead of using my insurance at the major pharmacy chain, I asked local independent pharmacies for their cash price. For one medication, The price through my insurance was $132 for a 30-day supply. The cash price at an independent pharmacy, just $48. There's another benefit to cash payments. They're typically final. Once you've paid a negotiated cash price, that account is settled. There's no chance of surprise bills or additional charges showing up months later. Many people don't realize that financial assistance for medical bills isn't just for the very poor. Most hospitals have charity care programs with income thresholds that can go up to 400% of the federal poverty level. That means a single person making up to about $54,000 might qualify for some assistance. Even though I had retirement savings, my current income qualified me for a 40% reduction through my hospital's financial assistance program. The application was lengthy and required documentation, but for a savings of over $9,000, it was absolutely worth it. Don't assume you won't qualify. Hospital financial counselors told me that millions of dollars in assistance funds go unused every year because people don't apply. Income isn't the only qualifying factor. Many programs consider your overall financial situation, including existing medical debt. There are also condition-specific foundations that offer financial assistance. When I needed an expensive medication for my recovery, I discovered that there was a foundation specifically for patients with my condition. They covered $3,200 of my medication costs over 6 months. Pharmaceutical companies also offer patient assistance programs. These programs provided me with nearly $5,000 worth of medications at no cost during my recovery period. All it took was filling out forms and having my doctor sign them. The key is to ask explicitly about all available programs. Say, I'd like information about every financial assistance program I might qualify for, including charity care, payment plans, and any disease-specific foundations you work with. One of the most valuable skills I developed was learning to spot and challenge questionable billing practices. This goes beyond simple errors to identifying systemic overcharging. For example, hospitals often engage in something called upcoding, billing for a more serious diagnosis or procedure than what actually occurred. When my emergency room visit was coded as a level 5, I questioned it because I knew my case was straightforward. I requested my medical records and compared them to the billing codes. Sure enough, my visit didn't meet the criteria for level 5 complexity. When I challenged this with specific documentation showing why it should have been coded as a level 3 visit, they adjusted the bill downward by $1,740. Another common practice is unbundling, charging separately for procedures that should be billed together at a lower rate. My surgery had been unbundled into separate charges for the procedure, the surgical tray, the anesthesia setup, and various monitoring services. Medicare and most insurance companies require these to be bundled into a single charge. I pointed out specific Medicare bundling rules, and they rebundled the charges, saving me another $3,450. I also discovered I was being charged full price for medications administered in the hospital, despite the hospital receiving these drugs at deeply discounted rates through a federal program called 340B. When I mentioned this program by name, the billing specialist immediately offered to adjust the medication charges, saving me another $2,100. This detective work isn't easy, but the financial return is enormous. I spent about 15 hours researching and challenging various charges, and saved over $15,000 as a result. That's a return of $1,000 per hour for my time. Throughout my nursing career, I saw how relationships affected care and billing. Patients who developed positive relationships with their providers often received more attention, better care, and more billing flexibility. During my treatment, I made a point of being exceptionally pleasant with everyone, from the receptionist to the nurses to the billing staff. I learned their names. I asked about their families. I expressed genuine appreciation for their help. When it came time to negotiate my bills, these relationships proved invaluable. The billing specialist I'd befriended went the extra mile to find discounts in programs I qualified for. My surgeon personally called the insurance company when they initially denied coverage for a procedure he deemed necessary. One particularly effective approach was working directly with my doctor on costs. During a follow-up visit, I was honest about my financial concerns. I asked, "Doctor, is there a less expensive treatment option that would work almost as well?" He switched my prescription to a similar but much more affordable medication, saying, "This should work just as well for most patients, but we usually start with the newer one because of pharmaceutical influence." That single conversation saved me over $2,000 in medication costs over my recovery period. I also built a relationship with a hospital financial counselor who became my advocate within the system. She alerted me to a billing error before it even reached me and helped fast-track my financial assistance application. Remember that behind every medical bill is a human being who has some discretion in how rules are applied. Building genuine connections with these people can make a tremendous difference. Sometimes, despite your best efforts, you'll hit roadblocks with unreasonable billing departments or insurance denials. Knowing when and how to escalate your case can be the difference between paying thousands or getting those charges reduced or eliminated. When my insurance company continued denying coverage for a critical medication despite my doctor's appeals, I had to escalate. First, I requested a formal internal appeal, which they denied again. Then I requested an external review by an independent medical organization. This independent review overturned their denial, saving me $8,400 over my treatment course. For hospital bills, I learned that escalating to administration often produces results that frontline billing staff can't offer. When I reached an impasse with the billing department over a disputed $4,700 charge, I researched the hospital's leadership team online and sent a concise, professional email to the chief financial officer. Within 48 hours, his assistant called me and the charge was removed. Another powerful escalation technique is filing a complaint with your state's insurance commissioner or Department of Health. When my insurance company was dragging their feet on reimbursing out-of-network emergency care, I mentioned that I was preparing a complaint to the state insurance commissioner. Mysteriously, my claim was approved the next day. For particularly large or complex disputes, consider hiring a professional medical billing advocate. These professionals typically charge either hourly rates or a percentage of what they save you. In my case, I hired an advocate for one particularly complex bill of $12,800. She charged me 25% of whatever she saved, and ultimately got the bill reduced to $5,200. Even after paying her fee, I saved over $5,000. The key to effective escalation is remaining calm, documented, and persistent. Keep detailed records of every conversation, including names, dates, and what was promised. Follow up every phone call with an email summarizing what was discussed. Create a paper trail that demonstrates your reasonable efforts to resolve the issue. After navigating this complex billing journey, I developed strategies to prevent similar problems in the future. These preventative measures have saved me thousands on subsequent medical care. First, I now get cost estimates in writing before any non-emergency procedure. When I needed a colonoscopy last year, I requested a written estimate that included the facility fee, doctor fee, anesthesia, and any potential pathology costs. When the bill came in $840 higher than the estimate, I simply sent them their own estimate, and they adjusted the bill to match. Second, I verify network status for every provider before receiving care. For planned procedures, I get the names of everyone who might be involved: surgeon, anesthesiologist, assistants, the facility itself, and verify their network status with my insurance. I get reference numbers for these verification calls and note the name of the representative. Third, I now have a standard script I use before procedures. I'm verifying that everyone involved in my care will be billing my insurance at in-network rates. If there are any providers who don't participate in my insurance network, I need to know now so we can discuss alternatives. This simple statement has prevented several potential out-of-network surprises. Fourth, I've set up alerts on my insurance company's website to notify me whenever a claim is processed. This allows me to catch and address problems immediately, rather than months later when they're harder to resolve. Finally, I maintain a medical billing folder with all my EOBs, bills, and correspondence. This organization has been invaluable for spotting duplicate bills and tracking what's been paid. So there you have it, the exact strategies I used to slash my medical bills by over 60%. From understanding the billing game to becoming a medical billing detective, these approaches saved me tens of thousands of dollars during one of the most challenging periods of my life. What strikes me most, looking back, is that none of these strategies required specialized knowledge that's out of reach for the average person. Yes, my nursing background gave me some insider perspective, but everything I've shared today can be learned and applied by anyone facing medical bills. The healthcare system isn't designed to be navigated easily. In fact, its complexity often works against patients. But armed with the right information and a willingness to advocate for yourself, you can dramatically reduce your medical costs. I went from that terrifying moment at my kitchen table, wondering if I'd lose my home to medical debt, to paying less than half of what I was originally billed. And I did it all while recovering from a serious illness. If you take nothing else from this video, remember this: your medical bills are negotiable. The first number is never the final number. You have more power than you realize to affect the outcome. I hope sharing my experience helps you navigate your own healthcare costs. If you found this valuable, please consider subscribing to this channel for more practical financial advice. And I'd love to hear your own medical billing stories or questions in the comments below. This is Margaret, signing off. Stay healthy, stay informed, and never pay the sticker price for healthcare. Thanks for watching.